This split-screen diagram illustrates two distinct clinical models for understanding asthma. On the left, we see the modern medical definition, a localized condition characterized by inflammation and hyper-responsive bronchial airways. On the right, we have the traditional Chinese medicine framework. TCM treats asthma as a systemic dysfunction of qi movement and fluid processing. Instead of isolating the pathology to the lungs alone, it maps a chain of dependencies across multiple organ networks, specifically focusing on how phlegm retention disrupts the entire respiratory sequence. Classical texts categorize this presentation using two specific terms: xiao, which describes the audible wheezing and constriction, and chuan, which refers to dyspnea, or the mechanical difficulty of breathing. To manage xiao and chuan effectively, practitioners have to look past the airway itself. Suppressing the local inflammation provides temporary relief, but long-term correction requires repairing the underlying systemic triad of the lung, kidney, and spleen. Within this framework, acupuncture acts as a modulatory and supportive therapy. It regulates autonomic balance to ease airway constriction and strengthens the body's wei qi, or defensive qi, to reduce sensitivity to environmental triggers. However, there is a hard boundary to this modality. Acupuncture is an adjunct therapy, not a replacement for emergency intervention during a severe acute attack. Practitioners must remain vigilant for severe clinical warning signs. A patient presenting with hypoxia, a bluish tint indicating cyanosis, or status asthmaticus, a prolonged unresponsive asthma attack, has crossed from chronic dysfunction into acute physiological failure. Patients exhibiting any of these acute signs must be directed to conventional emergency medical care immediately. Recognizing and respecting this boundary keeps patients safe during life-threatening episodes, while preserving the deep, modulatory benefits of TCM care for long-term management and prevention. To understand the pathology, we first have to map healthy respiration. This diagram models the baseline flow. Air, or heavenly qi, enters the central lung node. The lung is then responsible for dispersing this intake and driving it downward. This active downward push is the lung's primary mechanical role. When it functions correctly, the chest remains clear and breathing is effortless. But the lung cannot complete this cycle alone. Deep in the lower body, the kidney acts as the anchor. It must generate an upward grasping force to catch and anchor the descending qi, allowing the physical inhalation to be deep and complete. Supporting this vertical exchange is the spleen. Sitting laterally in this model, it continuously processes and transforms fluids, ensuring that the internal pathways remain clear of obstruction. Smooth, unimpeded breathing relies entirely on this unbroken chain. The spleen must transform fluids, the lung must ascend the air, and the kidney must firmly grasp it. When this chain breaks down, asthma occurs. Often, it begins with the spleen. If its fluid processing capability weakens, fluids stagnate and condense into viscous phlegm. This phlegm migrates upward, eventually clogging the lung. TCM classical texts summarize this mechanical relationship clearly. The spleen is the source of phlegm, but the lung is the container. Once the lung is obstructed by phlegm, the descending qi hits a physical wall. Unable to travel down, it reverses direction, erupting upward as rebellious qi. This specific upward friction is what creates the audible wheezing and coughing. This blockage doesn't only stem from internal spleen weakness. External pathogens, like invasions of wind cold or wind heat, rapidly constrict the exterior, triggering immediate airway obstruction. Internal emotional states exert a similar mechanical force. Periods of intense grief, sadness, fear, or anxiety physically disrupt and knot the flow of lung qi, preventing it from descending properly. Whether the initial trigger is dietary phlegm, a sudden cold breeze, or severe anxiety, the final mechanical result is identical. The lung fails to descend, creating the rebellious qi we observe as an asthma attack. Because the endpoint looks the same across different triggers, practitioners must use highly specific clinical signs to reverse engineer the true underlying cause. This diagnostic matrix helps break down those differences. An acute wind-cold attack presents with sudden wheezing, an aversion to cold, and prominent chills. We verify a wind-cold pattern by checking the details. The patient will produce thin white sputum, exhibit a thin white coating on their tongue, and have a distinctly floating and tight pulse. Contrast this directly with a phlegm heat pattern. Here, the wheezing is noticeably louder, accompanied by chest fullness, irritability, and extreme thirst. The clinical indicators align with excess heat. The sputum is thick and yellow, the tongue body is red with a yellow, greasy coat, and the pulse feels slippery and rapid. Precision here is crucial. Applying a warming, dispersive treatment to a hot, sticky phlegm heat pattern will rapidly exacerbate their obstruction. Conversely, trying to clear heat in a wind-cold patient will only deplete their remaining energy. Once the pattern is identified, the acupuncture strategy follows. For acute excess patterns, the immediate goal is to open the lung, descend the rebellious qi, and clear the physical obstruction. The primary points used to execute this acute strategy include the extra point Ding Chuan, combined with Ren 22, Du 14, Lu7, and Lu5. Needling these specific locations targets the autonomic nervous system, helping to physically relax the bronchial spasms and restore a normalized downward respiratory rhythm. The strategy completely changes for chronic deficiency patterns. Here, the goal is to tonify the systemic organs, the lung and kidney, to rebuild the body's ability to grasp and hold qi. This requires a different, deeper point prescription: BL13, BL23, ST36, KD3, and Ren 6. Tonifying this lower network strengthens the patient's wei qi, fortifying their external defenses so they become far less reactive to seasonal allergens and environmental triggers. The clinical rule is absolute. Acute points push pathogens out of the system, while chronic points anchor the internal structure. A successful treatment depends entirely on identifying which phase the patient is actively experiencing. Acupuncture is highly effective at clearing pathways, but clinical intervention cannot outpace a daily lifestyle that continuously generates internal phlegm. Managing the spleen's workload requires strict dietary boundaries. Patients must eliminate cold foods, excess dairy, damp-producing diets, and completely stop smoking. Introducing cold, damp foods forces the spleen to work twice as hard to extract nutrients. When the spleen is overworked, it inevitably leaves behind unprocessed fluids, which quickly condense into the very phlegm that will eventually clog the lungs. To actively support the system, patients are encouraged to maintain a diet of warm cooked foods, practice daily breathing exercises, engage in moderate physical activity, and prioritize adequate sleep and stress management. Real long-term resolution of asthma demands that the patient actively defends their spleen and lung function every single day between clinical visits. The most successful outcomes in TCM rely on 3 factors: beginning intervention early, maintaining strict control over environmental and dietary triggers, and consistently rebuilding the underlying constitution. Without proper management, chronic asthma forces the body into progressive degradation. The lung weakens, the kidney loses grasping strength, and phlegm retention becomes a permanent fixture in the airways. This is why the TCM approach goes far beyond masking localized symptoms. The ultimate goal is to repair specific broken links in the chain, restoring the dynamic, downward movement of qi throughout the entire respiratory triad. By mastering accurate pattern differentiation and deeply understanding this systemic physiology,